Hello and welcome to Peace Advocacy Group. My name is Claudia Cometa. I am the CEO and Chief Patient Advocate with Peace Advocacy Group. I like to do these videos for the purpose of educating you and empowering you to be proactive in your own healthcare. Certainly I do that as a patient advocate for my clients, but there are pieces of information that might help you in your own proactiveness in your own healthcare. So what I want to talk about today is choice, and you do have a choice in the providers that you choose within your healthcare. You actually have a lot of choice in a lot of aspects of your healthcare, probably more than you even realize, because we typically will get a referral from, say, our primary care physician for a specialist, and we typically just blindly go to that specialist because we assume all the research has been done, they're sending us to the best one, no questioning that. I want to encourage you to look a little bit further, right? We research a lot of aspects of our life, a lot of things that we shop for and do. We research the hotels that we stay in, we research the movies that we go to. We have a lot of information and knowledge at our fingertips, and so we utilize that, but we don't always do that for our healthcare, and I find that very peculiar, and I encourage you to start doing that. So here's a few pointers on researching your providers. Now, I am obviously aware that there are some limitations with insurances. So there's going to be in-network providers, out-of-network providers. But assuming that, we're dealing with a list of in-network providers and you're doing everything you can to follow those guidelines, here are some tips to choosing a provider. One is check their licensure. Right? You just want to make sure that the licensure is clear, there's no outstanding issues, similar to like a Better Business Bureau, right? So every state has a Board of Medicine. So if you Google Florida Board of Medicine, you will find the webpage for the Board of Medicine, and on there you can actually look up a licensee. So for instance, I'm a pharmacist, you could look me up on the Florida Board of Pharmacy page. Similarly, on the Florida Board of Medicine page, you can look up a provider. So you can look up an MD, put in the name, and it'll let you know when they were licensed and if their license is active. That takes all of maybe 15 seconds and gives you just a great piece of knowledge to move forward. In addition, most of the time the providers will be working in a practice, and that practice has a website. Typically on that website there will be a list of providers, and they will list their bios or their CV or resume. Just basically a snapshot of where did they go to medical school, where did they do their residency, where did they do a fellowship if they did one, and are they board certified in the specialty that they are practicing in. Those are pieces of information you might want to know, and again, it's a really quick search. Now, you can also search reviews on physicians. However, keep those in mind, take those with a grain of salt, because typically most people aren't going to fill out a review unless they had a poor experience, and you don't really know what the circumstances were around that poor experience, but you might still want to look at them knowing that you're going to take them with a grain of salt, because you might have certain priorities. Maybe your priority is that that physician has a really great bedside manner, and you see several reviews that that's just not the case for that physician. Maybe that's not the first choice for you. So just take a little bit of time to review that information. I do that for my clients, but certainly you have the information at your fingertips to do that for yourself and your family members. So I encourage you to utilize the knowledge and resources that we have and know that you do have a choice. I hope that was helpful for you, and I'll see you next time.